I think when people think about health, they think blood pressure, temperature, whether you're sick or not, but they make up actually only 20% of what actually comprises your health. The other roughly 80% is something known as the social determinants of health. Things like where do you live, what's your socioeconomic status and your income.
FwdSlash is addressing specifically housing. Our systems are designed to be about profits. We want to balance that with human empathy and really addressing the needs of all people.
If you're not in a stable housing situation, you're utilizing the healthcare system at a different rate, at a different level. That's costing more money.
They're going to the emergency room more, checked into inpatient services more, and these are our costliest drivers of healthcare. More than that, they're using these services because it's kind of the only place they can go. We're not interested in building a new staff and sending them to random towns that we're not from. Instead, we want to utilize the existing resources and support those services.
So our theory was find a local organization to work with that provides housing services, find local housing units themselves, and then get dollars from Medicaid. And the housing end, which was from HUD, or Housing and Urban Development, putting them together, that gave us theoretically a large pot of money to carry out a housing first model. A lot of pieces. Fortunately, West Virginia was having a request for proposals for Medicaid, and one of the questions on the application there was, what are any housing programs going on? We just got to say, all right, we have this theoretical model. Could we pull this off? After about a year, we had 50% cost of care savings and 83% reduction in our utilization for that population that we house. So really good outcomes. Every health system wants to cut down on costs. Margins are already razor thin. And so to come into a room and say, hey, we can generate 40 to 50% cost of care savings on your highest cost, hardest to reach population, that's intriguing to them. Then to local nonprofits like Welcome House, we're kind of saying, hey, we can get you revenue for the work that you do already.
When my supervisor came to me and said that there was this great project, FwdSlash and Welcome House, the initiative was to help individuals on Medicaid, I immediately said yes. When you're homeless, you age differently. That has to do with you're always in survival mode.
Being homeless is very tiring. You don't know if you lay down to sleep, what's gonna happen to you, so you gotta kind of try to hide. I was diagnosed with stage 4 metastatic prostate cancer. I was back on the streets again. The social worker at the hospital ended up calling Welcome House. They were just awesome. I mean, I don't know how else to put it. First case manager, just one day she calls me and said, you have been chosen for rapid rehousing. And then I met with Sarah, and this is the end result. I couldn't believe it. I had to wake up and be like, is this even real?
I'm able to accomplish more as a case manager because I have a community of support that wants to help end homelessness.
The fundamental human condition of needing shelter should be primary in our design of the system, not the last end consideration.
From homeless to housed, it does take quite a bit of time, but because of FwdSlash and their due diligence, we've been able to house individuals from their intake day within the first 3 weeks. We have people who have been waiting for housing for 10, 15 years who we're showing units to right now.